Hello, all, and welcome once again. Let us dive straight into the basics of hematology today. First, let's read the question. A 20-year-old female is brought to the emergency department with a 2-week history of fever, abdominal pain, bloating, diarrhea, and vomiting. She has had 2 episodes of vomiting since yesterday and attempted to lose stools for a week. Her vital signs show a temperature of 100.5 degree, heart rate of 88 beats per minute, and blood pressure of 100 by 60 milliliters mercury. On examination, the patient reveals moderate tenderness in the right upper quadrant with mild distension. Stool samples are tested, and a diagnosis of ascariasis is made. Complete blood count reveals elevated leukocytes, especially those producing histaminase. Cell subtype with which of the following nuclear morphology will most likely be increased? A. Bilobe nuclei, B. Eccentric round nucleus, C. Hypersegmented nucleus, D. Kidney-shaped nucleus, E. Spherical nucleus. We can see a fine-tuning between a clinical scenario and the basics in the question. Foundational knowledge questions will mostly be organized in such a manner. It is always recommended to read the last line of the question first to orient yourself and navigate through the clinical picture accordingly. There you can find the best answer. However, let's have an overview of the topic for better acquaintance. Then, at the end, we will discuss the question and answer in detail. As you can see, the hematopoietic stem cells or CD34 cells are the progenitors of all blood cells. They can be found in the bone marrow and give rise to a myeloid and lymphoid cell line. These in turn mature into major cells found in the blood, including red blood cells, white blood cells, and platelets. This flowchart is worth memorizing for better understanding of the process of hematopoiesis. The key points you need to focus on are mentioned in this table and covers all the things which you will come across during your preparation. Note the lifespan, shape, nuclei, staining, and what the cells produce, along with any additional information. So for red blood cells, they are biconcave in shape, have no nucleus, have a cytoplasm filled with hemoglobin, with a lifespan of 120 days in adults. They contain a chloride and bicarbonate antiporter. Erythrocytes lack mitochondria, so they rely on glycolysis to generate ATP. HMP shunt is critical in RBCs for generating NADPH, which is essential for protecting against oxidative damage. Although lab ranges are given, it is always handy to learn them as it saves a lot of time. You can see how the ranges may present in various question banks or NMEs. Also note the terms erythrocytosis, anisocytosis, poikilocytosis, and reticulocytes. Similarly, for platelets, I will highlight the fact that platelets are cytoplasmic fragments which contain dense granules and alpha granules. You should know the 4 F's in alpha granules. These include the factor 1 Willebrand factor, fibrinogen, fibronectin, and platelet factor 4. Note that thrombopoietin stimulates the production and differentiation of megakaryocytes. This is useful information as well and may show up while testing anatomy, pharmacology, or physiology. Looking into the white blood cells, they are predominantly involved in immune responses and are as follows. We will now be looking into the table that highlights the important information about white blood cells. You can divide them based on granularity as seen in the 4th column. Granulocytes, most abundant to least abundant, include neutrophils, eosinophils, and basophils. Agranulocytes include lymphocytes and monocytes. Beginning with neutrophils, they make up approximately 60% of the white blood cells in the bloodstream. They have a multi-lobe nucleus and contain leukocyte alkaline phosphatase, collagenase, lysozyme, and lysosomal aeosinophilic granules. They are elevated in infection, steroids, stress, and exercise, which causes the demargination of these cells. Following them, eosinophils, about 3% in the blood, have a bilobe nucleus, and sometimes it may be called as a spectacle-shaped nucleus. These contain histaminase and not histamine, and major basic protein along with eosinophil peroxidase. These are characteristically raised in parasitic infection. Basophils also have a bilobe nucleus and contain heparin, histamine, and leukotrienes. These are characteristically raised in myeloproliferative disorders like CML. Lymphocytes are about 30% in the blood, have a rounded nucleus, and produce B and T cells. B cells produce antibodies and T cells produce cytokines. T cells are the most abundant circulating lymphocytes in the blood. Lymphocytes are raised in infections like infectious mononucleosis, pertussis, tuberculosis, and in malignancies like CLL. Monocytes, 6% in the blood, have a kidney-shaped nucleus and differentiate into macrophages. These are raised in chronic infections, autoimmune diseases, and tuberculosis. Here we have a collection of some other key cells. Macrophages have a kidney-shaped nucleus and differentiate from monocytes and act as antigen-presenting cells. They are present in key locations and change their names accordingly. Mast cells have a rounded nucleus and produce tryptase. One relevant condition in which these are activated is mastocytosis, characterized by peptic ulcers, flushing, and low blood pressure. Dendritic cells are also antigen-presenting cells. We can cover this in immunology later on. Plasma cells are found in the bone marrow and not blood. These have a clock-faced nucleus squeezed to the periphery of the cell. They are raised in multiple myeloma. Go ahead and pause the video to test what you have learned so far. Images are sometimes a favorite way to assess your knowledge, and I'm providing just that opportunity to learn. Here are the answers. Moving on to our question of the day, look at the key highlighted phrases in bold. Always note down the age of the patient as it is significant in understanding the underlying pathophysiology. Bloating here indicates accumulation of gases produced by the organisms, which is a very classic sign of infection. Similarly, loose stools and their intermittent frequency are a hallmark sign of scariasis. So they have already given the diagnosis. Now the cell producing histaminase, not histamine, is an eosinophil, not a basophil. But anyhow, it is bilobed either way. So the correct option is A. Feel free to indulge into the detailed answer explanations yourself. Otherwise, this would make the videos very long. This table is again very helpful and covers everything. You can eliminate the other answer choices as well, and it is a very effective way to approach a question in case of ambiguity. Here is the takeaway key point from the question. So finally, that's our motto, which is simple yet meaningful. I'm sure we will pick up the momentum in subsequent lectures, and I will try to make the concepts concise and relevant to you. Thank you for listening. Please leave your suggestions and questions in the comments. Stay tuned for more, and don't forget to hit subscribe.